This video log was really inspired by a question, but actually, to tell you the truth, it was even before the question that I had come up with this idea last week, and I've been wanting to shoot it. It's about lighting and fat grafting and how does this interact. Basically, if you think about a lot of before and afters you may see, a lot of it is all dolled up afterwards like a glamour shot. There really isn't any scientific integrity in terms of what you see with the result. The other thing beyond that is I want you to begin to understand how to interpret my results and why is it so important. I take all my photographs with overhead lights, not just the big overhead light that's sitting on top of the person, but a uniform embankment of lights in a very, very tight, small room. So there's uniformity in the lighting. But the lighting must come from the top downward and not have fill flash. And there's a very, very, very important reason why. Think about one fundamental thing. You and I, in this world, we live almost 98% of the time with only overhead lights. Let's take a few scenarios. If we're indoors, there are overhead lights. Right now, I'm sitting in a room with overhead lights. I have a little bit of fill light coming in for the studio lights, but this is an arbitrary, artificial environment. Most places have basically a top-down overhead light. Let's take an outdoor scenario. Except for being in a car where you're going to have oblique lighting coming in, you're going to have top-down lighting coming in from outside in terms of, for example, being at a beach or being just at a park. Well, why is that so important? Because I want my before and afters, one, to reflect reality, not a studio prop of a result, but something that, as if you were looking at my patient sitting in front of you, what the camera captures is what I want your eye to capture, because you are the beholder of my result. You're the beholder of your own result. So let's talk for a moment to understand what is so important about overhead lighting, because a lot of people say, you know, in certain light I look good, in certain light I don't look so good. And one of the responses someone gave me was, you know, this trick photography when you're going into a dressing room to buy new clothing, they make the light all subdued and evenly bounced off and everything like that, so that you will buy the clothing. Well, I don't want to give you any trick photography. Now, some of my patients have a little bit more makeup or a little bit less makeup, and that's usually because I don't want a patient to come in here and actually have to take all the makeup off or put on makeup. I think, generally speaking, I do try to control for makeup, but at the same time, I don't want someone to have to take all the makeup off or put all the makeup on. But the thing that I want to control that's very consistent is lighting. And when I do my photography, my door automatically shuts. There is no ambient light. There's no windows. There's no time change. It's like almost like a Las Vegas casino. It could be 4 in the morning. It could be 2 in the afternoon, and the lighting will always be consistent. Let's talk about the importance of overhead lighting so you understand the role of overhead lighting. Why is flash photography no good? Well, we just talked about it. We live in a scenario where all the time is overhead lighting. And what does an overhead light do for you? Well, it probably gives you the worst case scenario in many respects, because you almost always look bad unless you have subdued lighting. When the light is coming from on top, when we start getting older, our face starts to flatten and start to become lower dominant. And all the little areas of bone highlights and the emptiness and the transition start to become accentuated with those shadows. And so if you think about oblique or overhead lighting coming downward, casts a shadow on the face. When I return the convexity to the face, that convexity creates a better light reflex. I see that light reflex in my patients who even come through the door 30 feet away, 40 feet away, they look younger. And the reason a youthful face has light convexity and bounce. And also, if I can eliminate shadow zones where there are transitions across the face and unify the face, softening those transition zones are a way to really help enhance the overall balance of a face. I had a younger lady that said, Dr. Lamb, I can get a partial fat transfer somewhere else at a less expense than what you charge. Would you mind going ahead and give me a partial fat transfer? And that I rarely do. And part of the reason why is there's no way that you can begin to understand the beauty that I can create on a face if I arbitrarily divide it into just a hole here, a hole there. You become the dictator of taste, and you become the dictator of how to rejuvenate a face. Whereas what I try to do is look at the face as a gestalt, as an entirety. Because when you and I relate to each other, we don't relate to each other as a left nostril, as a right cheek, as a left eyelid. We relate to each other as a face. And so what I do is create a unified, gorgeous face that you and I would love to look at. And that uniformity of eliminating transition zones over multiple parts of the face will create the highlights that make a face look youthful. So what are these shadows and highlights? Well, for example, the brow convexity. That's something that, in my opinion, shouldn't be compromised. The tear trough, lower eyelid transition into the anterior cheek. The anterior cheek transition to the outer cheek, the depression, the bone exposure to the outer cheek and blending that. The buccal hollow and transition, and I even in another video subdivided that into 3 components. The canine fossa near the area of the anterior cheek. The fullness of the anterior cheek that causes too much of a light reflex that I want to blend in. The anterior chin, the upside down U I talked about by other video. The prejowl sulcus, which causes a depression. Sometimes with overlifted faces, the depression of the outer mandible. What I'm saying is that there are multiple 20, 30, 40 micro little changes. And if I can create a blending effect over that area with normal overhead lights, that would be fantastic. In fact, my mother, whom I did her face 18 months ago, said something that was quite profound. I simply have forgotten how to put makeup on. And the reason is you don't have to fight as you get older to try to cover that hole, try to soften and blend the bone exposure here. And that it makes it so much easier to actually make the face look good. There's one final thing I do want to talk about besides uniformity and transition, but also how the skin appears with better light reflex. Because a lot of people say, well, is it the stem cell changes that occur with fat grafting about 1 year to 2 years out that makes the skin look so good? Well, perhaps, yes. But again, that's not something that I could be consistent enough, even in my understanding of the stem cell changes, that would create positive changes, that I could promise or guarantee that to you. I rather think of something much more fundamental that's almost a guarantee if you think about it, which is that if I can create the light convexity in this, the convexity of the face in the right places, the light that's shining down bounces off the cheek, bounces off the brow highlight, bounces off the outer chin, and that light that hits a face automatically makes the skin look better. Because if a skin is shadowed and uneven, any kind of acne scarring, pores, all those things that don't have the light reflex to capture it, makes the skin look god-awful. So remember, a lot of times when you're struggling with the skin, oftentimes it's not the skin. It's the absence of light on the skin. It's the exposure of bone that makes the skin look bad. It's the shadowed components where there's no uniformity over the face. So lighting is very profound, and it's amazing that oftentimes I think some of my patients are actually more intelligent than some of my colleagues, because my patient that wrote me the question said, Dr. Lamb, don't you think that lighting that is really something that actually is almost always overhead? And isn't that something that affects the way that we look, and I can never get lighting perfect? Yes, that is absolutely correct. You don't need to read a plastic surgical textbook to understand that. That's a fundamental. So hopefully that short little didactic about understanding lighting and the effect of it that it has on the face, and how to create honest photography to be consistent with real world scenarios is an important understanding of both scientific integrity as well as understanding real life scenarios and how to represent it through photography, and then beginning to understand how that reflects aging in your